Doctors Association, members of the press, invited guests, staff of the hospital, ladies and gentlemen. Assalamu alaikum to all of you. The Edward Francis Small Teaching Hospital Cardiology Unit is mainly funded through and by a Norwegian charitable organization called SCANAID International. Mr. Martin is the chairman of that foundation. The project was conceived in April 2019 by my humble self and my friend and big brother, Dr. INAUGURATION. We talked about it while drinking tea, and then we asked ourselves if it is possible. And we answered and say, yes, it is possible. Where there is will, there is possibility. Aina told me that he was going to approach his friend, who was a businessman by the name Jorgen. When he was approached, he endorsed the plan, and he said he was going to give us his full support. He even pledged that through his foundation, which is SCANAID, and his partners, that they were going to raise a sum of about $60 million in 5 years to build a cardiology unit in the hospital. Unfortunately, before his dream was realized, he passed away. And Martin replaced him as the chairman of SCANAID. And Martin wasted no time in supporting us. He joined the struggle. We came to the hospital. I remember at the time, Dr. Charles Robert was the acting CMD. I told him about the project. After 3 months, he didn't hear from me. I traveled to Nairobi. He wrote me a text message on WhatsApp and said, Dr. Jete, your project, is it still coming on? I said, sir, yes, in fact, we are working on it. So he was one of the people who was pushing. Shortly after that, we started working very hard. Myself here in the Gambia, Martin and Aina in Norway, and their colleagues. They came down from the Gambia. Then Professor Nyan was the CMD. We went to him, we met him, we had an MOU, and I remember Prof. Nyan said, I hope it will be done. I said, yes, sir, I think it will be done. I hope it's not just a paper. I said, no, sir, I think it will not just be a paper. The MOU was signed, and then 2 weeks after that, the foundation stone was laid, and building was started by Jigo Construction. Why do we need this project in the Gambia? I think all of you will agree with me that, like many low-income countries, the Gambia is faced with dual burden of diseases. While we continue to fight infectious diseases, such as tuberculosis, malaria, HIV, respiratory and diarrheal diseases in children, non-communicable diseases continue to rise at an alarming speed. Among which complications of what we cardiologists call ASCVD, I don't want to bother you, components of which include stroke, myocardial infarction, some people call it heart attack, critical illnesses from complications of heart diseases, lung and kidney diseases, are the leading cause of death in the adult population in this country. I can tell you that, and there are doctors here who will agree with me, it is no more malaria in the adult population. These diseases are killing us. Stroke, heart failure, problems with lungs, kidneys, these are what is killing us. I have to say that cancer is also on the increase. I can see Dr. Bojan sitting there. I know he's having his plans for that, especially cervical, breast, and hepatocellular carcinoma. And this also adds to the burden of non-communicable diseases in this country. Madam First Lady, even though complications of cardiovascular diseases such as I mentioned above are among the leading cause of morbidity and mortality, which you can simply call as illness and death in the Gambia, there was no dedicated unit or department in any public health facility at the time that we conceived this project, including the FSTH, for the treatment of these conditions. And this is why we think it is time to have this dedicated unit. And why did we choose FSTH? It is the main referral hospital in the country. It has a total bed capacity of more than 500, to be precise, 581 currently. It takes about more than 15,000 admissions per year, over 200,000 clinical visits annually. It is also the teaching hospital for the Medical School of the University of the Gambia and the American International University. It receives patients from all across the country, from public, private, and NGOs. It offers clinical service in most specialist areas and engage in training medical students, interns or house officers, and residents in affiliation with the West African Colleges of Surgeons and Physicians. It is also a training center for nurses, pharmacy technicians, radiology technicians, physiotherapists, and allied health staff. It provides subjects for local and international researchers, especially in collaboration with the London School of Hygiene and Tropical Medicine at the Medical Research Council in the Gambia. Madam First Lady, based on the most recent available data, cardiovascular and metabolic diseases combined are the leading cause of morbidity and mortality at EFSTH and by extension in the Gambia. They account for more than 55% of admissions annually and jointly contribute to about 69% of total death. These alarming figures call for more concerted efforts toward a higher quality specialized cardiac care. And this is why me and my friends and all those who supported us said it is time to have something like this in the Gambia. Madam First Lady, the project is in phases. Phase 1 is completed. It's composed of an outpatient clinic, a non-invasive cardiovascular diagnostic facilities, including ECG, echocardiogram, ambulatory BP monitoring, Holter monitoring, and exercise stress tests, and a 6-bedded ward for inpatient treatment of patients with cardiovascular diseases. The unit will focus on operational excellence as well as excellence in clinical outcome based on patient-centered philosophy. And this is why if you look at our motto, we say, every heart is special. To us, every heart is special. We will focus on training, especially cardiologists. I can tell you, as one of the only 2 cardiologists, Gambian cardiologists in this country, I know what I go through. And I have to give a special thanks to my wife especially, because it is not easy with her. So therefore we need more cardiologists. We need more cardiac technicians. We need cardiac technologists. And we need specialized cardiovascular nurses, and so on and so forth. We have international partners who are ready to support us. We have 4 of them sent their recorded messages. I think the DJ will play later. They want to help us in training, in providing equipment, and other forms of support. Most importantly, Madam First Lady, we want to do research on cardiovascular diseases in this center. Because without research, you are stagnated. Research is what pushes you. So we will make sure that research is done here, data is produced, that is beneficial to the Ministry of Health, especially, since they are the policymakers. Honorable Minister. Madam First Lady, to conclude, I want to tell you that the second phase of the project, hopefully, will not take long before it kickstarts. And in this phase, we intend to have an interventional cardiology unit within this facility. And what is meant by that is that we'll be doing things like coronary artery stenting, coronary angiogram, peripheral artery stenting, angiogram, and cardiac surgery, inshallah. Madam First Lady, I'm an interventional cardiologist, but since I came back, I've not touched any of the equipment of interventional cardiology. I want to make sure that it will not take long before I start doing that in this country with my colleagues. I would like to thank you and your husband for creating the enabling environment and for supporting our Honorable Minister, who has a vision to make sure that the healthcare in this country is advanced forever to higher heights. I thank you all for listening.
Your Excellency, All Minister, Hospital Administration, SCANAID has been educating young Gambians in Brufut and in the areas around for more than 30 years. Since 1992, we started the first school there. Our focus for all these years have been education, healthcare, and nutrition. The best students finishing 12th grade at our secondary school may every year have a scholarship to study either in the Gambia or in other African countries. Together with the INAUGURATION Children Foundation, we have supported students to become nurses, doctors, teachers, and also lawyers, among others. I visited the hospital several times during the year, and we have had doctors, medical students there. And I remember 7 years ago, I went into the children's unit next to us there. And I thought, there's a lot of very fine buildings here in the Gambia. Why is the hospital not among them? It really should be. It should be the best. We have also supported the education for Dr. Lamin Jaita to be a heart specialist, and the contact with him made this happen. Our chairman in the SCANAID Board of Governance here in Gambia, Mr. Osman Shah, had a book launch in November 2021, together with Dave Youngenil. They call the book The Gift of Friendship. They have known each other for more than 20 years. The book described how it was to be raised here in Gambia and in Holland. Despite these differences in the living conditions, in family size, and also in religion, they found they had much in common, especially when it comes to values in life. In my opinion, there are two main categories of people. It's the one they want the best only for themselves, and the ones they wish is the best for everyone. Here in the Gambia, I've met a lot of the category that wishes the best for everyone. And many of them are among our friends. And they help us so we can help you having education. And now also better healthcare from this day on. Einar Gude, he asked SCANAID if we could help him and Dr. Jaita to build this heart clinic. Together, we finalized the planning. We applied INAUGURATION Children Fund for funds. We involved Mr. Sham, and we also involved our technical supervisor, Mr. Tal, to help us accomplish the planning. Mr. Sham and Tal started the dialogue with 3 contractors here in Gambia. We received quotes from them, and among the contractors, Gigo Construction was chosen to build this heart clinic. Later, the contract was approved by the hospital administration. During the autumn 2021, the work at the plot here started. It was in the rainy season, so we had to postpone it for some weeks, but finally we could start. Later the contract was, one year after we made an amendment for a contract with GIGO for an outdoor record office and a new pharmacy in front of us there. The reason is to ensure that we have control on the quality of the medicine given to the heart patients here at the heart clinic. During the building of the clinic, we have worked closely with Dr. Jaite, Dr. Gude, and the hospital administration. GIGO, together with our technical supervisor, have solved the construction challenges without compromising on the building quality that was required. GIGO and Mr. Tal have carried out the mission according to our expectations. Your Excellency, Home Minister, Dr. Jaite, we would like to express our gratitude to everyone who has made this project possible. Our congratulations to Edward Francis Small Teaching Hospital, Dr. Jaite, and the Gambian people. You now have a brand new building, brand new cardiology unit. We hope our excellent cooperation will continue in the years to come. I would like to present some copies of a small book which shows the building process on the different stages since inscription. And I will give one example to Your Excellency, the Home Minister, and the administration of this hospital. Thank you.
I first share my biggest thanks to the mighty SCANAID, the land of victory, where our great heroes and heroes are nurtured to be victorious. Seriousness, rendered attemptum nobolius. Your Excellency, the First Lady of the Gambia, Madam Fatmata Barbaro, Honorable Minister of Health, Dr. Ahmed Lamin Samate, Mr. Jaite, respected guests, distinguished ladies and gentlemen, I greet you all in a humble way by saying Assalamu alaikum. My name is Khadija Tudabo, a student from SCANAID Junior and Senior Secondary School. Today I am purposely here to recite a poem entitled Health, and here it goes. The Arabian proverb says, and I quote, "He who has health has hope, and he who has hope has everything." And I says, health is better than wealth, but wealth is not better than health. And health is more important than wealth, but wealth is not important than health. Souls get lost, some died, some get sick and weak because their health is what is gone. Some died because they can't afford it, and they died because of distance. They son. Lii daw na yaram képp doomi aadama ku nekk bëgg na wérgu yaram pour dunda. So this house today, the opening of this beautiful house, a home of hope and health, a home of peace that will ease the heart of Mother Gambia, a home that make the people of the Gambia so proud with excitement. What a fungan kanun telu tentu keja yi katu jata kende ya mukunyon tagalti baluokon. For the lives lost before will be minimized today. For those that cried before will smile today. Let's be praised and be proud, because this is a beautiful heart failure. So many people died because of heart failure. So many people were abandoned because of heart failure. But guess what? That problem of yesterday will be minimized today. Your heart, my heart, and our hearts are in a safer side. They are beautiful souls of Mama Gambia. Let's protect and care for our hearts as usual. Let's come and visit this clinic for the betterment of our hearts. Remember, it's not a single man work but a collective one. We can make this place the best place if we want, and I know we can because we are known for love and care. Cleanliness and support are what we need to adopt. And in the end, we will all smile, glow and blow in health. I will win and shine in the light of the blessings. Our children will enjoy it with joy and care. For that sign you made is because of health. For that smile you made is because of health. Health is the fundamental right for every human on earth. Without it, life is worthless. Your poetress, Dawajula, the girl of a mission that has a vision, Sankaranka, the glorious, SCANAID, I rep. Thank you all for your lovely and wonderful kind attention.
Her Excellency, the First Lady of the Republic of the Gambia, Fatoumata Barrow, the Minister of Health, International Board Chairman of SCANAID International Organization, Mr. Morten Skelbrett, the local board chairman, Mr. Usman M. Cham, government officials, distinguished ladies and gentlemen, international and local board members of SCANAID, media fraternity present, and all other protocols are duly observed. SCANAID started with a community school called Bruford Nursery School. In 1992, an association called Life Scandinavian, through the leadership of Anfield Toof and his team in Norway, sponsored the school and later changed the name to SCANAID Nursery School. By then, the school enrolled 75 boys and 80 girls. During these years, SCANAID does everything for the school by sponsoring them with stationeries and furniture, providing food for them, salaries for the teachers, uniform, and so on. In 2004, the SCANAID board in Norway, Jørgen Bredesen and his team came with a plan to build a senior secondary school with the assistance of the head teacher of SCANAID Nursery School, Mrs. Terema Jai-Sane, the PTA of the school, and the family of the late Alcalo of Bruford, Alaji Khalifa Sano, went to the late Alcalo for land, and through him, land around the cemetery was allocated to SCANAID. Later, a senior secondary school was built and was taken with good care by the late principal, Madam Mariama Balde. May her soul rest in eternal peace. Within 5 years, a lower basic school was also built, and now we have an upper basic school. Through schooling care and nutrition, all these 4 schools were built for the people of Bruford and the surrounding villages through SCANAID and the board in Norway. The people of Bruford and SCAN teachers are so grateful to the Scandinavian and saying a big thank you to them. Tomorrow belongs to those who prepare for it today. A seed planted today takes root and grows into a tree that bears fruit in the future. Over 30 years ago, a seed was planted. Today, that seed of the idea of excellence has grown into an institution called SCANAID, located in the heart of Bruford, providing quality education to Gambians and non-Gambians. Today, SCANAID is ready to make an impact in healthcare, in ensuring the well-being of the people of this country. Inaugurating the first heart clinic in the Gambia is a plus for the healthcare sector. This initiative will help to transform lives and have a positive impact on communities. Then we would not hesitate to say thank you by extending our gratitude to the International Board Chairman of SCANAID, Mr. Morten Skelbrett, and the team, who double as the International Chairman, by saying, gratitude is what turns what we have into enough and more. It turns denial into acceptance, chaos into order, confusion into clarity. It makes sense of the past, create peace for today, and bring vision for tomorrow. SCANAID International Organization has invested in the education of many young people in the Gambia. Since inception of the senior secondary school in 2004, many of their students are sponsored up to the university for their education with a monthly stipend to support them while studying, giving them a good foundation and a baseline for a better life. That's why it is taught in the school motto, a future and a hope. Education is the weapon we can use to change the world. And Mandela said, I quote, through education, the daughter of a peasant can become a doctor. Through education, the son of a mine worker can become the head of the mine. Through education, the son of a president, the son of a farm worker can become a president of a great nation. He said, it is what we have, not what are given, separate one person from another. The youths are the bedrock and pillars of any prosperous country, and therefore investing in their education is one of the best ways of developing them into assets of prosperity. And this is what SCANAID International Organization has been doing since they arrived in this country. Not every child can get a scholarship from the government, but at the end of the day, the rest might be absorbed by philanthropists, organizations, NGOs, and private sector for sponsoring. If a child is admitted to SCANAID and obtain good results, need not to wonder about paying for a university tuition fees and financial costs incurred during the studies. SCANAID will stand firmly to wipe the tears of that poor child to see the person happy to obtain a world-class education. SCANAID today, they are support through scholarship, which I also benefited from. We are able to produce professionals from all walks of life, such as teachers, doctors, nurses, managers, accountants, administrators, etc. Finally, on behalf of the sponsored students of SCANAID and all the ex-students, we are grateful for all that SCANAID International Organization has done for us at the time when it was needed most, giving us a future and a hope, educating generations, impacting lives and changing narratives, promoting girls' child education, etc. I conclude my speech by quoting a Norwegian proverb. It's better to be a free man in a small house than to be a slave in a mansion.
Thank you very much, Mr. Mane. We want to thank you and thank the SCANAID Education